Hi, welcome back to my series High Blood Pressure. In fact, the first episode I have already published. This is the second episode, and this episode will be dealing with what high blood pressure can do to your body. This is very important to remain aware about what can be the consequences if somebody is having high blood pressure. Now, high blood pressure can lead to artery damage. Your arteries should be sturdy, springy, and smooth to move blood easily from your heart and lungs to your organs and other tissues. High blood pressure, or HBP in short, pushes too hard on your artery walls. This damages the inside and causes fat or plaque to collect. They get deposited into your arteries, which is known as atherosclerosis. In fact, this narrows down the passage through the artery for blood to flow. That plaque makes your arteries more stiff and narrow, so they can't do their job well. The next thing what high blood pressure can do is aneurysm. It's when pressure pushes out a section of an artery wall and weakens it. This is how the thing that is aneurysm happens in the system. If it breaks, it can bleed into your body and that could be serious. It's possible in any artery, but an aneurysm is most common in your aorta, which runs down the middle of your body. If you have damaged artery, you could get an aneurysm even if you don't have high blood pressure. Then it can be coronary artery disease, in short, what is known as a CAD. Now, coronary artery disease or CAD happens when plaque builds up in arteries close to your heart, what I described as atherosclerosis, like building up or deposition of fat or cholesterol in the artery, thereby narrowing down the artery walls. This slows blood flow, which can bring chest pain or a strange heart rhythm, which is called arrhythmia. A total blockage can cause a heart attack. Heart attack. When enough plaque builds up or a clump of it comes loose to completely block an artery to your heart, it can cause a heart attack. The blockage stops the heart muscle of oxygen and essential nutrients that can hurt to destroy it. You usually feel pressure or pain in your chest, but sometimes in your arm, neck, and jaws too. It might be hard to breathe and you could be dizzy or nauseated. Call emergency if you have any of these warning signs. Then the next consequences of carrying high blood pressure in your system is peripheral artery disease, or in short PAD. Now PAD, or peripheral artery disease, is like coronary artery disease, which I have just narrated in my last slide. So what happens in PAD? In PAD, it affects blood vessels further from your heart, like those in your arms, legs, head, or stomach. You might have pain or cramps in your legs, often when you walk or climb stairs. It can also make you tired. The pain may go away when you rest and come back when you move. Left untreated, peripheral artery disease or PAD could bring more serious problems like stroke, ulcers, and loss of circulation in your legs, which can lead to even amputation. Heart failure can be the next consequence for high blood pressure. High blood pressure can cause your arteries to narrow, as I explained already. Over time, that can make your heart work harder and get weaker. Eventually, it gets so weak that it can't supply enough blood to the rest of the body. This is heart failure. Enlarged heart can be another consequence of high blood pressure. As it works harder to move blood around, the muscle of your heart thickens. As a result, your whole heart gets larger. The bigger it gets, the less abilities to do its job, which means your tissues might not get the oxygen and nutrients they need. Next consequence can be stroke for high blood pressure. High blood pressure, or HBP, is the top cause of stroke. There are two types of strokes. Hemorrhagic, a weakened artery bursts in the brain. Ischemic, a clump or clot of plaque comes loose and blocks blood flow to brain cells. Part of your brain starts to die when it doesn't get enough blood. This can hurt your ability to think, move, speak, and see. For symptoms, remember first, that is face dropping, one of the symptoms of stroke, then arm weakness, another symptom for stroke, speech problem, a third problem for stroke, and of course time to call emergency when somebody is having a stroke. So that is the face or first symptom in short for a stroke. Now, dementia can another consequence for high blood pressure. HBP can cause plaque buildup in arteries that supply your brain. The clogging of those arteries can slow the flow of blood to the rest of your body. When it changes the way your brain works, it's called vascular dementia. It might affect how well you think, speak, see, remember, even the way you move. This usually happens slowly over time, but if you have a stroke, you could notice symptoms very quickly. Kidney failure is another consequence of having high blood pressure. High blood pressure is the second leading cause for kidney failure, in fact. It narrows and hardens the blood vessels your kidney use to help get rid of waste and extra fluid, because the kidney works as a filter in your system that keeps special filters called nephrons from getting enough blood and nutrients that can eventually shut down your kidneys for good. Even it can be eye problem which can come from having high blood pressure for over a period of time. Over time, high blood pressure can slow blood flow to the retina, the light sensitive layer of tissues at the back of your eyeball. It can also slow the travel of blood to the optic nerve, which helps send signals to your brain. Either may blur your vision or in some cases make it go away. High blood pressure might also cause fluid to build in your retina that could scar the tissue and distort your vision. Sex problem for men is a consequence for having high blood pressure. High blood pressure can slow down blood flow anywhere in the body. Without enough blood in your penis, you may have problem getting or keeping an erection. If you thought you were healthy, this may be a sign that you need to see your doctor to check your high blood pressure and rule out related health issues. Similarly, there can be sex problems for women who are having high blood pressure. Your body may respond differently because of less blood flow to your vagina both before and during sex. You might not be as aroused when you want to be, and it could be harder to climax. High blood pressure can also make you more tired. It can reduce your sex drive or libido as it is called. Bone loss, another consequence for bearing with high blood pressure. People with high blood pressure often have more calcium in their urine. It may be that high blood pressure causes your body to get rid of too much of this mineral, that is calcium, that's so very important for strong bones. This can lead to breaks or fractures, especially in older women. Sleep apnea can be caused by high blood pressure. This makes your throat muscle relax too much and stops your breathing briefly but repeatedly as you sleep. High blood pressure seems to cause sleep apnea, which in turn appears to raise blood pressure. Now, that was all about the second episode, that is, what high blood pressure can do to your body. Work with your doctor to treat both conditions as soon as you can. It may prevent other health problems. Now, for the first episode, I'll be providing the link in the description box, because in the first episode I have described about basics of blood pressure and certain frequently asked questions. If you have not seen that episode, you can just go to the description box where you'll get the link which I am providing specially for those who want to see the episode number 1. The third episode, of course, will be on surprising things that raise your blood pressure. Another very important thing, and people should be aware about the things or surprising things that can raise your blood pressure. Thank you for watching episode number 2 of this series, Blood Pressure. Hope this educational info definitely was useful to you. For more such information, relevant, useful, helpful, and practical medical tips for you, your near and dear ones, as I always say, please subscribe to the channel. The subscription button will be on the bottom of your right hand side corner. Please press that button and subscribe if you have not yet subscribed. Before I wind up today's laughter dose. Yes, if you can drive your car in India without abusing anyone, you have attained inner peace. Think it over. Thank you and see you soon with my third episode on blood pressure series. Till then, take care.